ADHD and anxiety. Somebody who has a primary diagnosis of ADHD can have symptoms of anxiety. They can be worried or nervous about their grades, performing well on tests, or what their parents might say about their grades. On the other hand, someone whose primary diagnosis is anxiety can have symptoms that look like inattention in the classroom. For instance, if a child is sitting in the classroom who has anxiety, instead of listening to the teacher, they can be worried about their cat or dog at home, they can be worried about mom coming to pick them up, or they can be worried about forgetting things. ADHD and depression. Again, somebody who has a primary diagnosis of ADHD can have symptoms that look like depression. They can be sad or down about their grades, depressed about not being able to continue football because of their grades, or sad about their parents' response to how they perform in school. On the other hand, someone who has depression can have symptoms that look like ADHD. Someone whose main diagnosis is depression can have lack of motivation, cloudy attention, or trouble concentrating because of their depression. A lot of people who have ADHD can have trouble with sleeping. Sometimes people who have ADHD can have trouble sleeping because their brain does not stop or slow down at bedtime. Another reason that people who have ADHD can have trouble with sleeping is as a side effect of their medication. Sleep disorders can also look like ADHD. If a child or a person has trouble with sleeping, the next day they can be sleepy or falling asleep or not able to concentrate or focus the next day at school or work. Also, sometimes people will fidget or squirm, and that can look like hyperactivity, but it's actually a way to help them stay awake during the classroom or at work. Another symptom that we can see with people who have issues with sleep that can look like ADHD is they may misbehave because of being fatigued or tired due to not being able to sleep the night before. ADHD and bipolar. Bipolar disorder is primarily a mood disorder, and this usually comes in waves. So they have periods of normalcy, and that's mixed in with mania, hypomania, and depression. ADHD, on the other hand, is a chronic problem, so usually the symptoms or behaviors are present all the time. Sometimes ADHD and bipolar symptoms can overlap, such as impulsivity symptoms, hyperactivity symptoms, and inattention. ADHD and learning disorders. Learning disorders, I like to think of that as speaking a different language. If a child is in a classroom and they have a specific learning disorder, like dyslexia, which is just one of many, to them that teacher seems to be speaking a different language. So if that teacher started speaking Chinese and they don't speak Chinese, then they wouldn't pay attention because they wouldn't understand what was going on. So learning disorders are sort of like that. They can look like inattention, but in reality, they could actually have a specific problem with reading, writing, or math. In order to tell the difference between ADHD and other diagnoses that can look like ADHD, a specific evaluation should be done with a trained health professional. For more information, contact us at Focus MD Birmingham.